All right. Now, one of the days, I am going to put together all the program behind the scenes so that you will enjoy. It's really interesting. All right, Dr. Tuyi Mebawondu, thanks for staying with us on the program. Now, we were looking at, the fallouts from the floods and the challenge that it poses to all of us and what we need to do and how we need to be proactive about all of these. Now, before we went on the break, we were talking about the challenges in the health sector. Now, in the last year, or let me say almost 2 years, a lot of our doctors and health workers have been moving in droves to Europe, America, parts of Asia, and all of that.
Saudi Arabia.
Saudi Arabia, exactly. And in fact, some even moved to Rwanda and even Kenya and Tanzania. We hear the reports of some of them moving there because of when they make comparison between the system there and Nigeria, they feel, oh, Kenya is close by here, But how does this compare? Because you were talking of the magnitude of the challenge from cholera to Lassa fever to all of that. We had them already before, but now with this flooding, the numbers could increase. And if the numbers increase, of course, everyone is going to get to the hospital. And then you get to the hospital, the number of doctors we had before that has either by half or by some percentage reduced. I wonder what we have on our hands from that window.
More nurses are even moving. For those are very critical at the primary healthcare level. More laboratory scientists, pharmacists, they're moving. So a doctor is just a signal, of a measure of how the movement is. It will continue to increase.
Professional atrophy.
Yes, it will continue to increase. And unfortunately, strike, even at the production level, because you see, when you are looking at your human resources setting for health, you are looking at people taking science in secondary school. You are looking at capacity to train and capacity to utilize. It's a stream, when you get stricture at one part, especially at the university level of training, it's a big problem. There's a disillusionment if you're trying to embrace any of the science courses now because of that current strike and then shortage in terms of training. So we need to raise the training. It's not just about, we need to raise the training first. How we're going to do that, especially those cadre of workers as we work at the primary healthcare level, where majority of our problems are actually situated. We need to raise the training. Secondly, we need to incentivize. We must be able to. The basic healthcare fund is too tiny to deal with all the numbers of 30,000 primary health care centers all over the country. It's too small. So now, while we're waiting to get that training done to move people to raise our primary healthcare system, we have to push health literacy. Local government can do a lot by specific health literacy. If I'm in a flooded area, I know that my own concern is to actually push waterborne diseases and tell them, my people, campaign, ring bell, try to clear gutters, do those things. That can even serve as a means of employment for a lot of people. But if you're in a meningitic belt, also campaign about we are entering the zone. We can do a lot with health literacy. For me, as far as I'm concerned, that is where we are. The second thing we can do is to do with vaccinations. There are vaccines for so many things. There's vaccines for cholera, typhoid, so many diseases that actually, beset us. So move those vaccines. Let people take the vaccines, because normally the first thing you actually do when you are setting up an IDP is to move in and vaccinate them, measles, cholera, typhoid, so that you don't see the occurrence of those diseases. Apart from that, what else can you do? Either you give incentives for people to stay in that locality, or you produce more doctors, because you can't import doctors, you can't import. Who is even going to come here? But it comes to a point where priorities, what do? We can then look at some of those faith-based organizations or NGOs and specifically encourage them to do health work in certain locality, especially on rich localities. So a mixture of the faith-based NGOs, education, health education, and then, of course, compulsory postings of medical students to some of those localities. I as a medical student, I was posted to local environments to do some health work under supervision.
At the grassroots level.
At the grassroots level. And that was the training we had those days. Of course, we can revive those training. But Teachers are on
But young
strike.
ones now
The
will
teachers are on
will
strike.
lobby to stay in the metropolis, you know. And so.
Well, because again, we need to deal with this concept of I have long legs. It's a lot of issues.
A long time I heard that expression. long
Exactly,
legs.
long leg.
Yes, I have long legs. I can influence things. It's what I want to happen that will happen. I can always buy everything. And that issue, because when a country is having challenges, the first thing you need to deal with is law and order. Everything in life stands on law and order. Once you cannot get that sorted out, you're wasting your time. And I don't want to start discussing some, because I'm supposed to discuss health. I'll leave it at that health. Okay? Yes. So even in health, there should be law and order. Even in training of doctors, or even in training
of structure
of even the working of lecturer, there should be law and order. Because in reality, if I'm supposed to train this set of graduates to be the top thinkers for us, and I abandon them, the thing will come back to hurt me.
As they say, the first law in heaven
will come back
is
to hurt
order.
me. It's order. That's all.
Now there is also another aspect of health we need to talk about: mental health as a result of this thing.
Wow, you see the increased number of suicidal. It's a complex thing.
Yeah.
Economy, substance abuse, and of course the role of social media. The social media is there, the substance abuse is there, which is very huge. Because a lot of those drugs actually, create what we call suicidal ideation.
Thinking about
how to die, how to, and then they're not afraid. They don't even feel the compassion departs from a lot of people using one of those drugs. And if you see what NDL has been doing, seizing catches of massive amount of substances from different so-called highbrow areas in Lagos, you'll be amazed that is this what we have gotten to. So, and we have not even structured a proper education system to deal with mental issue in this country. They're still hanging with this spirituality and enemy attack. So we have not been able to come forward and say that we're really having problem. Let's discuss how to deal with mental health. Of course, we're trying to do something with NDLE, to actually give people opportunities. But first and foremost, you don't even have sufficient mental health experts. You can virtually count on your hands the number of psychiatrists still remaining in the country. And we're not, because when you are planning, you plan based on your problems. Education should be focused to solve problems. Planning should be focused to solve problems. God forbid, if you have that kind of person running a very tricky institution, person with mental health running a very tricky institution, it will be a problem. And even for us, we don't even do that check whenever we are sending you to a very sensitive position. Of course, they will say go and do your blood pressure, and those one can be maintained.
What of your mental health?
What of mental health? What of mental health? So, honestly, and you see,
if somebody steals 80 billion, don't you think that person has problems with his mental health?
And want to use to buy a house.
There's a mental health challenge. For anyone to reason and think like
this.
I'm going to steal 80 billion. The next thing I want to do, I want to marry a 16-year-old girl.
Yes.
For goodness sake. You wonder that, wait a minute, what's going on here? Is that all you can do with that money?
It's not only that the person has problem with his mental health. He's going to impose that mental problem on the 16-year-old girl.
And even many, even the children.
And the children.
So honestly, we should start having it's not just conversation. We should move away from conversation. We're having this conversation. We should move to action. Critical action on mental health. We run the town. We see it every day. We see the preponderance of substance abuse. We see how this is affect the mentality of those young ones, and these are the people that when I have white bear ready. When I finally get very old,
I think I have mine.
Those are the people that is going to take care of me. Those are the people that will run this country, and we cannot start punishing them by closing their universities forever. We can start. It's not going to work.
All right. We have to start now being proactive towards all of these, from government to organizations to individuals to institutions. We must thank you, Dr. Tuyi Mebawondu, for coming on the program.
Mike, always a pleasure with you.
Thank you.
Sam.
Great.
Great.